Hi, my name is Dr. Joel Jin. This is a training on deliberate practice in spiritually integrative mental health care. And let me provide a brief working definition of deliberate practice if this is your first time hearing about it. Deliberate practice, or DP, is a set of principles about learning and developing expertise. So using DP, these are 4 learning objectives for you to meet through this training. First, to describe deliberate practice framework for gaining expertise in mental health care. Second, to outline the skill criteria of 2 foundational micro-skills in spiritually integrative mental health care. Third, to practice 2 foundational micro-skills in spiritually integrative mental health care. And last, to review how to provide feedback during practice. Foundational to deliberate practice is purposeful and systematic rehearsal. DP addresses how to develop and practice, not what to practice. By purposeful, I mean that a trainee sets intentional time and effort to strive toward a specific goal. By systematic, I mean the trainee faces incrementally challenging practices for development beginning at their zone of proximal development, in reference to Vygotsky. The progression and succession of practice is informed by ongoing feedback from the trainee and an expert observer with a specific goal in mind. And last, by rehearsal, I mean that the trainee has repeated opportunities to meet the specific goal before moving on to greater challenges. In turn, trainees are stretched beyond their current capacity. DP emerges from the study of expertise, which is interested in studying what facilitates the development of top-level performers. Previous research across a variety of domains have found that engagement in deliberate practice mediates development of a person that results in their superior performance. This was found in music, chess, sports, business, and medicine and surgery as examples. The study of expertise is of great interest to the field of psychotherapy. As a result, prominent authors, researchers, and clinicians have endorsed DP to significantly improve therapist training, which ultimately is seeking to improve treatment outcomes. And as a reminder, practice is not the same as performance. As a result, deliberate practice, such as playing scales alone or shooting basketball shots alone, is in addition to routine performance, which are like the concerts for musicians, games for athletes, and therapy for therapists. To date, DP has been used for training in facilitative interpersonal skills, cognitive behavioral therapy, emotion-focused therapy, child and adolescent therapy, and multicultural therapy as examples. Check out sentiocc.org for more resources. However, little is known about how to use deliberate practice to enhance skills required for the practice of spiritually integrative mental health care. Now, what's important during this practice is to keep in mind the cycle of excellence. 3 components are crucial to superior performance. 1, determining a baseline of effectiveness, including both strengths and skills that need improvement. 2, obtaining systematic, ongoing, formal feedback, particularly from outcome measures and an expert. And 3, engaging in deliberate practice across extended time and using intentional effort to reach specific learning goals. The key is to find an internal motivation for deliberate practice. So with that primer on DP, in the following section, I will present exercises for 2 skills of spiritually integrative mental health care. First is spiritually integrative reflections, and second will be eliciting emotions of spirituality. So our first skill, spiritually integrative reflections, has 1 skill criteria to meet when implementing the skill. Your response ought to include the following skill criteria: to disclose an informed guess of how spirituality is impacting the client's experience. This is Skill Criterion A. So at this moment, if you've got a partner or if you're working alone, read out this client statement aloud. I've been avoiding my family's pastor since I've been back. They think it's good to connect with her, but mostly it's too difficult having any faith in God after all I've seen, especially a God who's supposed to make this world better. Now, improvise and practice a response based on the skill criteria of this first skill, and try avoid looking at example therapist responses for now. If you've given it a try, you can reflect on the skill criteria of spiritually integrative reflections. Did your practice and improvised response meet this skill criterion A? Did you disclose an informed guess of how spirituality is impacting the client's experience? If you're unsure, you could take a look at the example therapist response. So refer to the example therapist response after as an illustration of what a response could be. So for example, related to this client statement, a therapist could say, "Oh, you're concerned what the pastor might say to you when you're having difficulty with faith in God right now." And this would meet the skill criterion A. So of note, these example responses may differ from your responses because of your different cultural identities that you hold. And also remember to repeat the first client statement and practice with that statement as often as necessary until there is a high level of comfort before moving on to the next statements. In this next slide, there are 4 more client statements to practice with. Pause here to rehearse a spiritually integrative reflection for each of the client statements one at a time. Remember to check whether you meet the skill criteria after each response. If you try responding to all 5 client statements now, you've checked in with the skill criterion, you can take a look at the example therapist responses. And these are based on different cultural identities to demonstrate the flexibility and tailoring required when using these skills. Trainees of different cultural identities may have different responses as they practice. What's important is that we encourage you to improvise responses that meet the skill criteria and fit your identities and backgrounds. So after this first exercise, each exercise that we'll present will have skill criteria, client statements, and example therapist responses. And it's always fun to practice together. So we encourage viewers to try these exercises with a partner as they are presented or to pause appropriately to rehearse these skills. Now, if you're wondering what practice might look like, here's an example. After a trainee has improvised a response, you need to base your feedback on the skill criteria. Training partners or coaches can offer feedback. They can offer praise and encouragement on the specific skill criteria that the trainee's response met. Also, describe an actionable suggestion on how to meet any of the skill criteria that the trainee's response missed. So for instance, in response to the 5th client statement, a trainee might say, "Hey, you're worried about your husband." Here, the trainee's response misses skill criterion A. As a result, the trainee used a simple reflection. The skill of simple reflection is effective, and its use in this scenario can be appropriate. However, the current exercise is for the purpose of trainees practicing spiritually integrative reflections. Thus, the partner or a coach can say, "Hey, that's an appropriate simple reflection. Great work. With this exercise, let's practice reflecting the impact of spirituality on the client." Then, to integrate this feedback, the partner can repeat the 5th client statement and the trainee can improvise another response followed by brief feedback again. On the second iteration, the trainee might say, "I hear your worry about your husband's return because he thinks he's changed." Here, the trainee's response misses skill criterion A. As a result, the trainee used a complex reflection. The skill of complex reflections is effective in deepening clients' understanding and to verify a therapist's understanding of the client. Furthermore, the trainee's response acknowledges how the client's husband's change is the source of worry. However, the trainee's response misses how spirituality is impacting the concern. Thus, the partner or a coach can say a strong complex reflection based on the client's specific worry with the husband's change. This time around, try focusing on how the standards of the Bible, the impact of spirituality, is a source of concern. So then the partner can repeat the client statement another time, and the trainee can improvise another response integrating this feedback. Of course, trainees, partners, and coaches will have rationale on why the trainee's response missed criterion A. The structure and flow of deliberate practice exercise is to hold discussions after practice. Instead, the structure and flow of these exercises is to focus on trainees repeating rehearsal of the skill to allow sufficient opportunities of success within a low-stakes training environment. So here's a response of the trainee. I hear your worry about your husband's return because he thinks he's changed, particularly according to standards from the Bible. And this would meet Skill Criterion A. Now, throughout the practice, consider how challenging it is to fulfill the skill criteria of the exercise, and privately observe whether you notice any good challenge or too hard challenge signs and reactions. These ratings will indicate to yourself and to your partner or coach whether the practice is too easy, a good challenge, or too hard. And this is from Sentio University. Now, the second skill is eliciting emotions of spirituality. There are two skill criteria to meet when implementing this skill. Your response ought to include the following skill criteria. Skill Criterion A is to begin the question with a what or a how. And Skill Criterion B is to ask the client an open question about their emerging emotions about spirituality. These two skill criteria make up the skill of eliciting emotions of spirituality. So let's have a partner or yourself read the first client statement aloud again. Client says, I've been avoiding my family's pastor since I've been back. They think it's good to connect with her, but mostly it's too difficult having any faith in God after all I've seen, especially a God who's supposed to make this world better. Now, improvise and practice a response based on the skill criteria of this skill. Try to use eliciting emotions of spirituality and avoid looking at example therapist responses. Now, if you've tried to practice eliciting emotions of spirituality, see how you did based on the two skill criteria we reviewed before. Did you begin the question with what or how? Did you ask the client an open question about their emerging emotions about spirituality? And this can be the basis for a partner to offer actionable feedback. Also, we can refer to the example therapist response. So with this client statement, a therapist might say, well, what are you feeling related to the difficulty of having faith in God right now? Now, this eliciting emotions of spirituality touches on both Skill Criterion A and Skill Criterion B. Of note, these example responses may differ based on your cultural identities that you hold, and we also want you to repeat the first client statement as often as necessary until there is a high level of comfort before moving on to the next statement. If you're ready to practice, here are the same 5 client statements as before. This is to show that the same client statement can prompt a therapist to use several different skills in response. For each client statement, spiritually integrated reflections and eliciting emotions of spirituality are not the only applicable skills. Simple reflections and eliciting emotions could suffice, but today we're practicing on 2 spiritually integrative skills. Once you've practiced, take a look at the example therapist responses. But of note, trainees are encouraged to improvise your response to meet the skill criteria and fit their identities and backgrounds. As a reminder, try to practice together. And let's give an example of what giving feedback would be like during this skill practice. So for example, in response to the second client statement, a trainee might say, well, you're feeling sad and lonely. Here, the trainee's response misses both skill criteria of eliciting emotions of spirituality. As a result, the trainee used a reflection of feelings. The skill of reflecting feelings is effective to label emotions for the client. However, the current exercise is for the purpose of trainees practicing eliciting emotions of spirituality. So the partner or coach can say, you labeled the client's feelings. Nice. It's an appropriate response. With this exercise, let's practice eliciting emotions of spirituality. Then, to integrate this feedback, the partner can repeat the second client statement and the trainee can improvise another response. On the second iteration, the trainee might say, well, what are you feeling? Here, the trainee's response addresses skill criterion A, but misses skill criterion B. As a result, the trainee elicited feelings. The skill of eliciting feelings is effective to deepening clients' emotional experience and expression. However, the trainee's response misses how the feelings are associated with the client's spirituality. Thus, the partner or a coach can say, "That's a nice question," to elicit more emotions of the client. This time around, try focusing on how the feelings pertain to the client's spirituality. So then the partner can repeat the second client statement again, and the trainee can improvise another response integrating all this feedback. So they might say, "What emotion is that as you try to connect and find similarities with your congregation?" This improvised response can be similar to the first iterations with the integration of all the feedback, or it could be a completely new response as long as the skill criteria are met. Throughout the practice, consider how challenging it is to fulfill the skill criteria of the exercise and privately observe whether you notice any good challenge or too hard challenge reactions. These ratings will tell you and your partner or coach whether the practice is too easy, it's a good challenge, or too hard. So having gone through 2 different skill exercises, I offer 5 practice tips as you go into deliberate practice. Number 1, tailoring practice is key. There are no prescriptive responses on how to implement a skill. Even example therapist responses are illustrative only. So this provides a low-stakes training environment so trainees can cultivate their authentic voice. Number 2, let the trainee monitor their reactions. So you can monitor your thoughts and feelings, your body reactions and urges to inform when the practice is too hard. The trainee doesn't need to disclose these reactions, but only share whether their practice is too easy or too hard if you're working with a coach or a partner. Number 3, let the trainee guide the practice. When the trainee is feeling comfortable and the statement is becoming too easy, then continue to move on to a new client. When the trainee is feeling uncomfortable and the statement is becoming too hard, then try the same client statement or pause repetitions. Again, repeated rehearsals of improvising a skill, a new skill that you've just learned, is the key to deliberate practice here. Number 4, take breaks during your practice. Practice can become too hard for a variety of reasons and at any moment. And these exercises focus on you repeating behavioral rehearsals of the skill within your zone of proximal development. And 5, hold discussion or written reflection of why reactions are emerging after the practice. When you're practicing, focus on behavioral rehearsal, repeating, trying to meet the skill criteria. Afterwards, you can have discussions and reflections of what the skill is like or why you might have certain reactions, or hold conversations till later. So in summary, we overviewed the foundations to deliberate practice, which is purposeful and systematic rehearsal. Then we presented 2 micro skills of spiritually integrative mental health care and their skill criteria. We focused on spiritually integrative reflections and eliciting emotions of spirituality. Then you are offered 5 client statements to practice from and 5 example therapist responses per micro skill to reference. Last, we illustrated how feedback during practice might look. All stakeholders require an internal motivation for deliberate practice. Again, according to the cycle of excellence, 3 components are crucial to superior performance: determining a baseline, obtaining systematic feedback, and engaging in deliberate practice across extended amount of time. So as you begin to practice spiritually integrative mental health care skills, what's your motivation? Thanks for tuning in.